Moving on to the next topic, which is peritonsillar abscess, which is also known as quinsy, right? This is actually the collection of pus in the peritonsillar space. As we have discussed earlier, the tonsil on its lateral aspect is having a capsule, and there is a superior constrictor muscle in the bed of the tonsil, and in between them there is loose areolar tissue, and this particular space is known as the peritonsillar space, and any sort of pus or separation in this space is known as peritonsillar abscess or quinsy, right? What happens is that it follows acute tonsillitis. The crypta magna is infected, intratonsillar abscess occur, then it bursts, then it becomes peritonsillitis, and then the abscess occurs, right? So this is the etiology. So what do we do for diagnosis? We take the culture and then the culture of the pus, right? The Streptococcus pyogenes and the Staphylococcus aureus are the most common organisms that are causing quinsy. The clinical feature are important. There are two types, general and local. In general, the patient will be presenting with fever, chill, rigor, malaise, aches, headache, nausea, and constipation. And in the local symptoms, normally what happens is that there is severe pain in throat. Usually it is unilateral, right? And hot potato voice. This is something that you can be given in MCQ scenario, that hot potato voice is related with quinsy. Muffled thick speech, odynophagia, foul breath, ipsilateral earache, and trismus. Now, this is actually the clinical features which the patient will tell you, right? But on examination, the thing that you have to focus on is the position of the uvula. The uvula is actually deviated to the normal side, right? If it is swelling of the left side, it will swell so much that the uvula is pushed towards the right side, right? So the uvula is swollen and pushed to the opposite side. The position of uvula is of prime importance in case of quinsy. Cervical lymphadenopathy, torticollis can also occur. Investigation of choice is CT scan and MRI. Needle aspiration, culture and sensitivity can also be done. Treatment is important. We are concerned with the treatment in different aspects. The conservative treatment is that we hospitalize the patient, give IV fluids to that particular patient, analgesics and antibiotics are given, and oral hygiene is maintained, right? But then comes the invasive, in which the incision and drainage is done, right? Interval tonsillectomy is given. Actually, interval tonsillectomy means that tonsils are removed 4 to 6 weeks after an attack of quinsy. We are not going to remove them immediately or during the disease or during the infection. We are going to remove them after 4 to 6 weeks. Hot tonsillectomy is done as an alternative in those who don't want to take an incision, right? So these are the things that you have to remember. And sometimes, if not treated, the quinsy can cause complications, which is remembered by the mnemonic of POP SGS. Parapharyngeal abscess, edema of the larynx, pneumonitis, and septicemia, jugular vein thrombosis, and spontaneous hemorrhage. This is a sort of cram, so that is why you have to remember this particular mnemonic. Hope you understand.